One of the most popular features in JACC consistently is their Year in Cardiology series. And I, with two people who just did the Year in Interventional Cardiology, I'm with Dr. Simon Dixon at the end and Robert Safian in between. And the two of you, this was a kind of an interesting year. You had 135 citations, I think, in this article. I don't even want to know how many papers you actually had to review for this. What was the big thing in the year? What do you think in the past 12 months was the big story?
Rick, I think clearly the biggest thing in interventional cardiology this year is the whole area of structural heart diseases. There are a number of really superb publications in transcatheter aortic valve techniques and transcatheter mitral valve techniques, which really gave new and tremendous insight into the value of these technologies for treating people with valvular heart disease. And one of the most important things is that even though these technologies are fairly new in their evolution, we were able to identify major improvements in clinical outcome, improvements in left ventricular function, and improvements in chamber dimensions, all of which are going to have tremendous value for treating patients with valvular disease.
Yeah, 2011 was an amazing year. There were dozens and dozens of fascinating studies, and it was very tough to pick out the key articles. But I agree with Rob, without a question, the most important advances occurred in the structural heart disease field, particularly for aortic valve disease. And I think of all the studies, the PARTNER study really led the way as being the highlight of the year. The outcomes of that study, pitching a relatively early generation technology against a mature surgical technique, were really spectacular.
For each of you, what was the single topic or trend that you thought was going to be outside of these? What was the next thing that you thought was really important?
Yeah, I think in the vascular space, one of the things that was really cool is some of the information about the treatment of refractory hypertension and using the baroreceptor stimulation and the renal denervation are really exciting things. The other thing in the vascular space was the drug-eluting stents for treatment of patients with symptomatic outflow disease. I think both of those are really exciting.
Renal denervation gets all of the attention, it seems. The baroreceptor studies, which I'm also familiar with from my job, you think that was important too? Yeah,
I think there are interesting observations with the baroreceptor stimulation that seem to show very, very nice benefit for treatment of refractory hypertension.
For me, Rick, the big advances occurred. The next big thing was in the transradial space, and it was very gratifying to see two randomized trials in the space showing very similar outcomes for transradial compared to femoral approach, but at a marked reduction in bleeding complications. So I think the way forward for us in the U.S. is to promote transradial and really follow our colleagues in Europe and around the rest of the world.
Probably there is no final answer in medicine at all, but was there anything in 2011 that kind of came close to being a final answer?
Yeah, I think so. Maybe in a couple of different areas. Again, in the vascular space, I think the studies of carotid stenting versus carotid endarterectomy, the CREST trial, I think was a really, really important study. And I think that really is sort of the final comment on carotid revascularization, in that these two techniques, stenting and carotid endarterectomy, have very, very close parity to each other. I think some of the unresolved issues in terms of optimal medical therapy still need to be addressed, but in terms of recommendations for revascularization, I think carotid stenting and carotid endarterectomy really have parity.
So in the pharmacotherapy space, I think the JACC trial and results of N-acetylcysteine for prevention of contrast-induced nephropathy really is the end of that story. And I think that's borne out now in the new PCI guidelines with use of the N-acetylcysteine being a Class 3 recommendation. So that's the end of the story for Mucomist.
So at the other end of the spectrum, what topic got started in 2011 or maybe hit a critical mass to the point where we're going to likely hear about this in the years ahead?
Yeah, I think one of the most exciting things, again, is the renal denervation space. I mean, we're really starting to get some very interesting data about refractory hypertension and renal sympathetic nerve ablation, and I think this is just the beginning. We're likely to hear a lot more about this technology for refractory hypertension. The implications are enormous because this is an area that has impact in patients with heart disease, congestive heart failure, stroke, renal dysfunction, so I think we're just seeing the initial part of that wave.
Yeah, in the pharmacotherapy space, I think we saw 2 randomized trials evaluating the optimal duration of dual antiplatelet therapy. So I think in this year and beyond, we're going to see a lot more information. This has huge implications for clinical practice. There's still tremendous uncertainty about the optimal duration of dual antiplatelet therapy, so watch this space.
Thank you very much for coming and chatting with us. And what I wanted to mention is the fact that they're going to stick around. We're going to talk about more, and they're going to be a featured interview in CardioSource World News. If you haven't seen that, definitely check it out. And in JACC itself, the Year in Cardiology series, this time the Year in Interventional Cardiology, a wonderful summary of the last 12 months in interventional cardiology. I'm Rick McGuire.